Hi, I'm Karynn with Rain Dance Massage and Reiki, located in Vancouver, Washington, winner of the Best of Vancouver in the massage category for the last 5 consecutive years. Today's video, we're going to talk about what to expect in a professional massage session. If it's your first time, the massage therapist is going to want you to fill out a client intake form that's going to have your contact information and talk about any particular areas that you need treatment. They'll also want to know if you have any allergies to things like nuts, because a lot of massage oils are made from nuts, or if you're allergic to anything that might be in an essential oil, or sensitivity to certain scents, in case the massage therapist has incense burning or scented candles or something like that. We'll need to know about that. And then we'll also need to know about any medications you're on, if that pertains to, say, narcotic pain relievers, because the massage therapist won't want to work too deep on you because you won't be able to feel when it's too deep, or muscle relaxers, diabetic medication, heart medication, seizure medication, anything like that. They'll want to know if there's any particular areas you want to avoid. If you've got ticklish feet, or you don't like your scalp massaged, things like that, be sure and let the therapist know. If there's particular areas you want focused on, like if you're having chronic back pain, or you've had a whiplash injury, or something like that, or if you want just overall relaxation massage, be sure and let the therapist know. And then also be aware of feedback. Give feedback to your therapist. That's really critical. So if the therapist is working too deep, or if you want a little bit more pressure, or you want them to spend some extra attention in a particular area, be sure and let them know that. We're not mind readers, so yeah, please let your therapist know how they can make the session better for you. And then they'll ask you to get undressed to your level of comfort, or dressing down. So a lot of people will go completely naked under the sheet. Some people will prefer to wear their underwear. It's best to take up everything from the waist up, particularly if they're working on your back or neck, so we don't have to work around straps. That's completely optional whether you dress down completely or not. But do know that most states have very strict draping laws. So when you get a massage, the therapist is only uncovering the area that's going to be worked on, like say a leg. They're going to undrape one leg. And then as soon as the massage on the leg is completed, they're going to cover you back up again. So draping is for keeping the client on the table warm, but it's also for privacy. So the client is never exposed. Everything has to be covered unless it's being worked on, and most therapists will talk you through that, particularly the first time. As far as conversation goes, if you want to talk during your session, that's totally up to you. A lot of people like to just tune out and not talk, but completely up to you. Feel free to let the therapist know that as well, whether you want to just relax or take a nap or whatever, or if you want to talk or just start talking or not. Most therapists will clue in when the client is starting to relax and they start being more quiet, that's the time the conversation is over, and then they'll let you just zone out and enjoy the massage. There's a thing called emotional release that you should be aware of. So sometimes the massage, let me start over. So the premise is that trauma and emotions get stuck in the tissue. So you all know when you're feeling stress, you feel it in your body. Like, if you carry your tension in your shoulders or your neck, you're going to feel it there. So when that starts to relax and release, sometimes people experience what's called an emotional release. That can take a lot of different forms, and massage therapists are trained to keep an eye out for things like that. So some people might tense up, some people might stare, like wide-eyed stare. Some people may cry, some people may hysterically laugh. It all just depends on your experience, and You know, if it becomes too intense for you, and if it's stirring up something, or your body is like releasing something and that feels, you know, uncomfortable or foreign to you, just let the therapist know, like if you want to stop for a minute, or you want to stop the session altogether, or if you need a minute, or if you need a tissue or whatever. We're here to accommodate you. So don't be afraid of that. If it's coming out, it needs to come out. It's better to just release that and just, you know, let it go, and that will enhance your sensation of relaxation and inner peace, which is the goal of massage. After the session is over, the therapist, you know, will ask you how you feel. They'll ask if you know, you have any suggestions for us as therapists that you would like us to do different, or would like to have done next time. If you have, you know, like a lot of us do a lot of different modalities. So if you wanted to add, say, you know, hot stones, or try aromatherapy, or massage cupping, or, you know, Reiki, or, you know, something, whatever one of the therapists does, usually they have like a brochure. They'll talk about different techniques that they do. And you want to try something or curious about something, you know, please ask. And then we'll give you recommendations also for what to do after the session. So water is very key, because massage will release toxins in the body, and you want to flush that out. So definitely drink some extra water after the massage. If you're feeling a little sore after the massage, use ice. And if you use heat to relax, use heat like 24 hours later. Use it the next day. Sometimes an Epsom salt bath is a good idea. If you feel like you might be sore, or do experience soreness in the next day or two, that's a good idea. But really, water is key. If you drink enough water, chances are you're not going to feel sore, unless the therapist has worked too deep. And then there again is conversation that you'll have with your therapist for next time to make sure they don't work that deep if you experienced, you know, too much soreness. They'll talk about like frequency of visits, like how often you should come. Usually if you're experiencing symptoms, you want to come more frequently until those symptoms decrease in intensity and frequency. And then the goal is to come once a month for like maintenance. And that will keep you from slipping back into where you're symptomatic. That's the goal anyway. So the other thing I want to talk about in this session is client etiquette. So there's some do's and don'ts. So the therapists try really hard to create a very safe, relaxing environment for clients. So please arrive like 10 to 15 minutes early, particularly if it's your first time, because there will be that paperwork to fill out. But that also gives you time to use the restroom if you want to before the massage, because your appointment time is typically the start time that you should be on the table. So please allow time for that. And then, you know, again, know the office policies with payment and, you know, cancellation fee that should be covered in the intake paperwork. Please shower before you come in. I know a lot of people will think, well, if we're going to put, you know, massage oil on or lotion on, then I'm going to shower after. It's best if you shower first. If you're in a situation where you can't, where you're, you know, want to come from the gym, or you're all day at work or something like that, let the therapist know, because a lot of times we use hot, wet towels in our practice, and we can just have an extra one there for you so you can do a quick wipe down before your session starts. It's a lot more comfortable for you, and it's better for us too, because for example, if somebody comes in, you know, with a lot of body odor, we can technically refuse service and say you need to come back after you've showered. Or if it's like, right, you know, first thing in the morning, and you've, you know, after sleeping, you sweat when you sleep, and there's like little salt crystals on you. I mean, it feels like we're massaging sand into your back. So, you know, be aware of that. Make sure you're hydrated. You know, if you need to drink water before your massage, which we recommend, you know, maybe stop an hour before your session so that you don't have to use the restroom in the middle of your session. And then definitely, again, drink water afterwards. It's best not to have any alcohol or use drugs before your massage. For example, if you come in, say, New Year's Day and you've got a hangover. When we're doing the massage and releasing toxins and increasing the circulation, you can actually get drunk again. You can experience that getting drunk again, and people can get very violently sick after a massage if they're hungover. So yeah, best not to do that. You don't need that to enhance the relaxation. The massage will do it itself just by physiologically what the massage does for the body. And then lastly, I want to talk about appropriate and inappropriate behavior. So it is considered unethical for a massage therapist to date their clients. So please don't hit on your massage therapist. Don't be creepy and don't be inappropriate. A massage therapist can press charges for unwanted solicitation, so you don't want to go there. And if it's a situation where you're threatening a healthcare worker, that's a Class A felony, so don't go there. So don't be creepy, don't be inappropriate. And that would be very much appreciated. And that's it. So feel free to like, share, and comment and subscribe to my channel, please. And if you have any questions or additional comments that you want to leave in the bottom, feel free to do that. If you've got questions, I'll do my best to answer them as quickly as possible. So that's it. Bye for now.